Hello, my name is Michaela, and I will be talking about computer-assisted instruction. This is the content that will be covered in the PowerPoint. Description of a CAI, appropriate domain, pros and cons, appropriate uses in healthcare education with patients, peers, and student teaching. Computer-assisted instruction, also called a CAI, or computer-based learning, is an instruction via computer with graphics, pictures, text, the internet, programs, games, videos, classes, a lot of things through the computer can be used with a CAI. A CAI can stimulate learner, transform learning, give opportunities to different kinds of learning. It's dynamic and innovative. Students can access class through the websites or patients or peers to learn about information, different types of information with healthcare. A CAI can transform learning into an active and engaging process. It can also promote problem solving and develop critical thinking skills. CAIs are mostly used for a cognitive domain due to the nature that it's mostly used for a thinking area. So patients, learners are the ones who are being taught this information through the computer. They aren't necessarily being taught or being aware of their feelings toward their information that's being relayed. Usually that comes after their information or sometimes during, but mostly computer assisted instruction is for educational thinking, specific, just informational purposes. So psychomotor for skills like fine and gross motor skills. Those certain things can be taught through a computer by watching them, but the learner actually has to be doing that in order for that to be a certain domain. So it does not qualify for a CAI because the learner would actually have all of their equipment in front of them to do that with it. So it is more just for thinking and informational purposes. Appropriate uses in healthcare education with a patient. Younger learners nowadays use computers and more comfortable with learning through a computer. So sometimes that's a great way for them to engage more in their health, learn more, and interact more. Embarrassing topics also can be taught, such as sex, different areas that might be embarrassing for certain patients, learners, peers. Visual and audio learners benefit from this tremendously because they can see and hear all at the same time of what's going on. Usually in lectures, I know that I don't always see what's in front of me, or they're going back and forth, so I can't always follow my book to actually look at the certain equipment or the certain type area of the body. So when someone's lecturing me, I need to see it as they're lecturing me for me to thoroughly understand it. So usually after a lecture I have to go back and then relook at my book and learn that all over, or do that all over again. Patients, peers, students can also access medicational information. That can be very helpful because we don't usually give all of the information for one of their medications to the patient. That's a very overwhelming thing. Most patients know what they are taking. Procedures can also be accessed online for the patient to see what's going on or what's going to happen to them in surgery if they so wish to see that. But of course the nurse, the doctor needs to make sure it's a credible source so that they give the right information. I've listed some websites here that could be helpful. The Wired.md and the EPnet.com are both websites that show videos. So if they want to learn about their A&P, what's going on in their body, that would be a great way for them to learn. That way they can see how one area of the body affects the other all at the same time. Milner and Fenwick.com is an example of if someone prefers to learn in Spanish, they have Spanish subtitles, so that information can be relayed to them that way. Appropriate uses in healthcare education with peers. New information such as policies, procedures, any lectures that doctors need to do, charting, all is done through the computer. Learning, all of that stuff can also be done through the computer. Mostly, I think that a CII is more for student teaching and for patients. Appropriate use in healthcare education with student teaching. Information, testing, recall, visual audio learners, and skills can all be done through a CAI. You see a picture of the heart, the information of what the heart does, what type of muscle the heart has, where exactly the right atrium is, where the right ventricle is, and so on and so forth. Through a video and pictures and testing through a CAI can help them see, hear, and learn and recall information all at the same time. That can be very helpful for people to learn that way. Testing, I took testing with ATI and helped with seeing where I needed more help with in my learning, and it also gave me lots of questions so I can recall information. Skills can be taught through a CAI, although the learner would have to have all their equipment in front of them, but skill videos are very helpful for nursing students especially. There are some CAI studies that I found. One in the book said that a CAI increased efficiency of learning, retention of information, and an increase of recall and comprehension. There was one study that I found that compared computer game-based learning versus traditional lectures on anatomy and physiology of the head and neck to see what learning gains and knowledge retention was versus the other. The people who were a part of the study were given a multiple choice questionnaire of their prior knowledge, short-term knowledge retention, and long-term knowledge retention. The game-based performed better in the post-test assessment only with anatomy questions, and it's good for short-term memory retention. The traditional lecture performed better with both A and P questions, and that turned out to be better for long-term retention, short-term retention too. So in the end, it seemed that lecture won over the CAI, but it also depends on the learner themselves. One study that I found was with a textbook versus an interactive computer learning with neuromuscular blockade. This was used with first year anesthesia student, residents. The interactive computer learning improved test scores significantly over the textbook, and the students even favored the computer learning over the textbook. Another study was done by Goldberg and McCann with a virtual learning environment versus lecture that was being taught with neuroscience. the students eventually did better with virtual learning than a lecture. So it all depends on what the student's learning, who the students are, and how they prefer to be learning. The pros and cons of a CAI. The flexibility of a CAI is very helpful. The student can go on the computer whenever they want to learn. I know for me, I think that's very nice that I can go on and log on and have access to my lesson for that week anytime I would like. And I don't have to sit through the whole day for one session. I can log back in another 2 hours or the following day if I choose. Accessibility to a computer is another pro for using a CAI. Computers are found in libraries. If you do not own one, it is more prevalent for people to have computers nowadays. Students also have control over what they're learning and how fast they're learning. Teachers can and students can get varied lessons so they learn at their own pace and are not forced to learn something at a faster or slower pace than they would like. Teachers also can get feedback through the computer if the students are using the computer for a CAI. That way they can see where the students is excelling and lacking in and helping them with their future teaching. Sometimes a CAI can be helpful for those with health difficulties such as aphasia, visual and hearing impairments, or learning disabilities. They can be very helpful with a CAI because they can do it at their own pace. And those that prefer Spanish, they can have that in Spanish as well. A con can be for those with health difficulties as well. Motor difficulties, they could have a hard time pushing the buttons, accessing files online if they're unsure how to use the computer. So sometimes even those with health difficulties can't use a CAI. Programs for learning can be very expensive. For 1 hour of instructional material, it takes 500 hours to create, so a program can be very expensive, and the computers themselves can be very expensive for learning. Some people have a lack of computer literacy, so it's hard for them to understand how to use a computer, and it can be very frustrating, and the student cannot even learn at all because they're too frustrated with using a computer. You do lose personal interaction if you use a computer. You don't have that one-on-one. You can't ask questions freely to that person. You have to wait for their email to get a response. That can be frustrating as well. Use for cognitive domain only, as I explained earlier. Psychomotor and affective domain is not really used with a CAI. It's only for cognitive domains. And I would also not use a CAI for those non-directed and poorly motivated learners. They will probably not log on to the computer and do their work, so you need to be motivated and want to learn and use the computer for that to be a very positive thing to use. And these are my references. Thank you for listening. Hope you learned something, and I hope using through the CAI that the CAI PowerPoint was helpful.